My name's Daniel Bunker. I'm a specialist plastic surgeon from Launceston in Tasmania. I trained in Sydney, Melbourne and Europe, and today we're going to talk about breast reduction surgery. The most common patients I see requesting a breast reduction are patients having symptomatic or functional issues from having large breasts, and the most common things that I hear are issues such as shoulder pain, neck pain, back pain, difficulty finding clothes or bras that fit, or sometimes rashes under the folds of the breast, and that can be quite debilitating for patients. Patients requesting breast reduction surgery are most commonly seeking symptomatic relief, so there is a large functional element to the operation. Before having surgery, it's important to have a thorough consult so you can understand if you're a candidate for the operation, to make sure that any risks that can be optimised or reduced are, such as smoking needs to be stopped, for instance, and there may be preoperative imaging that needs to be completed to assess the breast tissue before surgery. During the surgery itself, which is normally done as an overnight stay in an accredited hospital, what we do is we remove excess tissue from the breast to reduce the size and the weight, and we also lift and reshape the breast at the same time. Most patients with large breasts have stretched areolas and a large low-hanging breast, and we aim to lift the breast up, reduce the size, and also reduce the size of the areola to a more appropriate size for the breast. In doing that, we take away a lot of the weight from the breast, which helps with symptomatic relief, and it also stops the fold rubbing on the chest wall skin. Patients generally spend a night in the hospital after a breast reduction and go home the next day after being assessed in the morning that they're suitable and safe for discharge. Breast reduction surgery generally has a high patient satisfaction rate, but it's really important you thoroughly understand the risks and complications associated with a breast reduction procedure. One thing I like talking to patients about especially is the placement of scars. All breast reduction surgery comes with scars, and the pattern of scars you have will depend on your particular surgeon, and also the weight and size of your breast and how much skin needs to be reduced. There can also be risks associated with moving the nipple in terms of the blood supply or sensation to the nipple, and your surgeon will discuss this with you as well.